Posture is the language your body speaks. Help it speak alignment, not strain. Taking care of your body isn't just about muscles and aesthetics. It's about sustaining your mobility, reducing pain, preserving mental clarity, and ensuring emotional resilience. Posture, alignment, and joint health are cornerstones of that care. One common misalignment many people struggle with is anterior pelvic tilt, APT, when the front of the pelvis tilts downward and the back lifts, exaggerating the lower back curve, lumbar lordosis. When left unchecked, anterior pelvic tilt can contribute to back pain, hip strain, inefficient movement, and compensatory injuries elsewhere. Correcting it is part of long-term self-care, helping your spine, hips, and soft tissues live in better harmony for decades. In this talk, we'll cover 1. What APT is and why it matters, 2. The root causes and risk factors, 3. How neglect shows up in health more broadly, 4. Warning signs, 5. Strategies to remediate and fix APT, 6. Prevention, self-care plan, 7. Scientific and historical context, 8. Consequences of ignoring it, and 9. Closing motivation and disclaimer. Anterior pelvic tilt, APT, refers to a posture in which the pelvis rotates forward, the anterior superior iliac spine, ASIS, moves downward relative to the posterior superior iliac spine, PSIS. This causes the lumbar spine to increase its inward curve, lordosis. Muscle imbalance pattern, often called lower cross syndrome, tight, overactive hip flexors, e.g., iliopsoas, rectus femoris, tight, overactive lumbar extensors, erector spinae, weak, underactive glutes, hamstrings, and deep abdominals. Why it matters: loads the lumbar spine more, shear, compression, alters hip mechanics and joint angles, shifts how forces pass through knees, ankles, and the rest of the chain, may contribute to chronic low back pain, hip discomfort, and inefficient movement patterns. In simpler terms, APT is a structural posture deviation that signals imbalance. It doesn't guarantee pain, but it raises risk and inefficiencies. APT rarely appears out of nowhere. It typically emerges from long-term lifestyle habits and systemic patterns. Key contributors include prolonged sitting, sedentary lifestyle, sitting with hip flexors shortened, glutes inactive, and lumbar spine often postured increases the tilt over time. Lack of balanced strength, mobility work focusing on squats, deadlifts, or upper body without glute, hamstring, core control, and hip flexor mobility aggravates imbalance. Poor posture, movement patterns habitually arching the lower back, overextending, hyperlordotic posture in standing, poor lifting mechanics. Muscle weakness, imbalances, weak glutes, weak deep core, transverse abdominis, obliques, weak hamstrings. Tightness, stiffness especially in hip flexors, quads, lumbar extensors. Overuse and repetitive loads. If your training excessively emphasizes extension, back bends, heavy lumbar extension, without counterbalance. Insufficient recovery, tissue health, inflammation, poor hydration, poor connective tissue quality, and inadequate rest reduce plasticity and adaptability of muscles, fascia, and joints. Other systemic factors: poor sleep, chronic stress, poor nutrition, hormonal imbalances. All these strain your body's ability to maintain ideal posture. While APT itself is a postural condition, when self-care is neglected in parallel, many broader health conditions can emerge. Chronic low back pain, degenerative disc disease, hip joint stress, early osteoarthritis, knee, ankle, foot compensatory injuries, musculoskeletal imbalances, soft tissue strains, poor movement efficiency leading to metabolic inefficiencies, chronic inflammation, metabolic syndrome, obesity, cardiovascular disease, diabetes, hypertension, via lifestyle neglect, mental health decline, fatigue, hormonal imbalances, immune compromise, frequent injury. In short, posture is one piece of the health mosaic. Ignoring one piece often correlates with neglect in others. APT or its consequences may show up gradually. Watch for persistent lower back soreness or stiffness, overarching hyperlordosis. In standing, difficulty fully straightening or flattening back, hip flex or tightness or front of hip pain, glute, hamstring weakness or underused sensation, feeling stuck in extension or arching. Posture in exercises, discomfort or strain when doing core work, squats, deadlifts, knee or shin compensation, forward knee drift, less efficient breathing, rib flare, balance issues, fatigue in core or posterior chain. If you see a cluster of these, your body is signaling misalignment stress. Correcting APT is not an overnight fix, it's a gradual, multi-layered process. Below is a comprehensive, progressive plan. Use caution and adapt to your condition. Step 0. Postural awareness and assessment. Practice pelvic tilts, posterior versus anterior. While supine and standing, learn to sense neutral. Mirror or video self in standing, note ASIS versus PSIS alignment. Check hip flex or tightness, Thomas test, hip extension, and glute core strength. Use foam roller or release, work gently on hip flexors, quads. Step 1. Stretch, mobilize tight structures. Focus on lengthening what is chronically shortened. Hip flexor stretch, kneeling lunge, push pelvis forward, posterior tilt, hold 30 to 60s. Quadriceps stretch, standing or lying, lumbar extension, spinal mobility, child's pose, cat camel, cobra, iliotibial band, tensor fasciae latae, TFL, release, stretching adductor, hip internal rotation. Stretches use dynamic mobility before exertion, static holds off days, gentle. Step 2. Activate and strengthen weak, underactive muscles. Key targets: glutes, especially glute max, medius, glute bridges, progress to single leg, hip thrusts, clamshells, side lying abduction, quadruped, donkey kicks, fire hydrants, hamstrings, Romanian deadlifts, with careful control, hamstring curls, Nordic curls, as able, deep core, pelvic stabilizers, dead bugs, bird dogs, planks, focused tailbone neutrality, Palloff press, anti-rotation core work, hollow holds, modified leg lowers, posterior chain synergy, Supermans, back extensions, with caution, good mornings, light, controlled, focus on control, alignment, slow progression. Step 3. Integrated movement and strength work with neutral pelvis. Once mobility and activation improve, reintegrate compound movements with better posture, squats, deadlifts, lunges, cue to maintain a neutral pelvis, not overarch. Use lighter loads initially to reinforce alignment. Use cueing. Posterior tilt, rib down, glute contraction. Use tempo and pauses to reinforce control, e.g. 3-second descent, hold bottom, ascend. Step 4. Maintenance, progression, and feedback. Gradually increase load, reps, complexity as control allows. Monitor fatigue, soreness, alignment regression. Deload or regress if posture tilts back. Reassess monthly with posture check, mobility retesting. Precautions and caveats: don't force perfect posture. Natural curves exist. Overstretching or overcorrecting can cause new tension. Use pain as red flag. Sharp pain, nerve symptoms need evaluation. In some cases, structural spine issues may limit how much you can correct. Always consult a physical therapist, chiropractor, or qualified movement specialist if unsure to prevent APT recurrence and support posture overall. Integrate these habits. Daily postural habit checks: stand tall, neutral pelvis, core engaged, micro breaks in sitting, stand, walk, hip extension breaks, gentle mobility, stretching between tasks, balance, nutrition, hydration, sleep, supports tissue health, ergonomic setup, chair height, monitor, keyboard, desk. Weekly dedicated mobility and flexibility session for hips, spine, glute, posterior chain strength session. Core stability work, active recovery, low-impact movement soft tissue work, foam roll, massage, monthly, quarterly posture, alignment recheck, mirror, video, markers, mobility reassessment, hip extension, lumbar flexion, extension, deload weeks or lighter phases health screening, vitamin D, magnesium, inflammation markers, hormone balance. Over time, these habits reinforce alignment, reduce tension, and help your body self-correct more readily. Historical movement traditions and posture, ancient yoga, martial arts, and classical physical culture emphasized spinal alignment, pelvis under control, and movement balance as part of holistic health. Origins of posture correction movements. In 20th century physical therapy and posture schools, clinicians recognized postural deviations, like swayback or lordosis, and developed corrective exercise protocols. Biomechanics and modern research, studies in kinesiology, rehabilitation, and biomechanics have documented how pelvic tilt influences lumbar shear forces, hip mechanics, and muscle recruitment. Lower cross syndrome concept, coined by Dr. Vladimir Janda, describing a characteristic muscle tightness, weakness cross pattern involving hip flexors, lumbar extensors, glutes, abdominals. Recent evidence and nuance. Some modern critiques argue that an ideal pelvis alignment is variable across individuals, and overemphasis on correcting tilt to zero may backfire. The trend is toward functional neutrality, control, and capacity rather than rigid correction. Thus, while the concept of fixing apt has roots in pragmatic rehab traditions, modern science encourages flexibility, individual variation, and progressive reinforcement rather than dogmatic forcing. If anterior pelvic tilt, or its underlying imbalance, is ignored long-term, the possible negative outcomes include chronic low back pain, disc degeneration, facet joint stress, hip joint stress, labral irritation, knee and ankle compensatory issues or joint wear, persistent muscle imbalances, tightness, and restricted mobility, loss of efficiency and greater injury risk during sports, daily life, reduced performance in lifts, athletic movement, flexibility, psychological frustration, movement fear, limited activity in worst cases, structural changes that are harder to reverse over time. What seems like a posture problem becomes a movement-limiting, quality-of-life issue. Correcting anterior pelvic tilt is not about chasing an arbitrary, perfect posture, it's about gradually restoring balance, strength, mobility, and control. Over time, those improvements translate into less pain, more efficient movement, and a body that better withstands life's demands. Start small. Daily posture awareness, gentle hip flexor stretches, glute activation, core stability. With patience, consistency, and feedback, your body will gradually realign. When you invest in posture and alignment, you invest in your long-term health, resilience, and freedom of movement. This content is intended for educational and informational purposes only. It does not replace medical diagnosis or treatment. If you have pain, structural spinal issues, or conditions such as herniated discs, it's important to consult a qualified healthcare provider, physical therapist, or orthopedic specialist before applying new exercise or posture protocols.